Hi, I'm Dr. Tim Elder. I'm a board certified family physician here at SIMEDHealth in Gainesville and High Springs. So, this is the time of the year that we see a lot of respiratory illnesses in the clinic. Common cold, we see a lot of, and people have a hard time sometimes knowing the difference between the cold and something else. It's common cold. Typically, you're going to have runny nose, sore throat, maybe a mild cough, but typically, you don't have a fever with the common cold. So the flu and common cold are both viruses. They both can have cough and congestion. But when it comes to a lot of separation between the two, the flu, you're going to have a lot of times fever, also going to have muscle aches and joint soreness. Um, the flu usually comes on pretty quickly, and the cold will usually kind of slowly get worse over a few days. A lot of times, if you get the flu, you know you have the flu and you can't function like you normally would. So it's very common that patients will come in with a cold or flu and request antibiotics. Unfortunately, antibiotics do not treat the flu or a common cold. It definitely would make my job easier if I could give you a magic pill and you get better quickly. But flu and cold, by definition, are viruses, and antibiotics will treat a bacterial infection. And so taking an antibiotic actually will not decrease the length of your condition or decrease the severity, and it actually can cause side effects with increased antibiotic resistance and possible gastrointestinal infection. So there's a lot of over-the-counter remedies for colds. You can go into the pharmacy and you see just a whole aisle of them. Anything that you can do that's going to probably like decrease your cough, decrease your sore throat, decrease congestion, all those work. So cough suppressants, decongestants, throat lozenges, all those will help you kind of feel better. Ibuprofen and Tylenol are also usually okay if you're having some sinus pain or any sort of other discomfort from the viral illness. You do have to be careful with some of the decongestants with any sort of history of heart disease or hypertension, as they can increase your blood pressure. So I typically tell my patients that most of these things they can take care of at home with over-the-counter medications. But if they're having problems where they're not getting better, they start spiking high fevers, they're not able to eat or drink, then I think it's very important to kind of come in just to be checked out, make sure there's nothing else going on, and we can try to do everything we can to make you better quicker.